Hi everybody, it's Dr. Eric Balcavage and we're back for another edition of Thyroid Thursday. Today I want to kind of continue on this theme that I've been talking about this paper, Environmental Issues in Thyroid Disease, a paper published in Frontiers in Endocrinology in March of 2017. And I want to talk about environmental factors that have been linked to thyroid autoimmunity. So in the paper they talk about these 10 factors that have been linked via the research to thyroid autoimmunity. So radiation is definitely one of those things that has been linked. They've definitely found the link, especially with those that were irradiated at things like Chernobyl. I actually have a couple patients that were irradiated via the Chernobyl catastrophe and developed autoimmunity following that. Iodine has been linked to thyroid autoimmunity, and its low levels of iodine can be a cause of thyroid autoimmunity, and excessive amounts of iodine can be linked to thyroid autoimmunity. So just kind of the three little better stories: too much, too little, and just right. So most people in the US don't have a deficiency of iodine. I know there's a whole camp that promotes high levels of iodine use and supplementation. I personally don't think that's necessary. I think you should not be inducing high amounts of iodine into your diet unless you've really shown or really proven that you have overt iodine deficiency. Selenium deficiency has been associated with thyroid autoimmunity, and selenium plays a role in thyroid physiology. It plays in detoxification, and so it's critically important micronutrient. The issue is, why would you be deficient? Well, if you eat an animal-based diet or you eat animal products, then chances are that you're not selenium deficient. It's in your food. If you're a vegetarian, you may be at a slightly greater risk of developing selenium deficiency. I would say if you do a test and you're found out that you are selenium deficient, you have to consider the fact that your body's chewing through selenium really quickly, or you're just not absorbing it very well because there's some type level of dysbiosis in the GI tract, and you should have that looked at. Smoking is associated with thyroid autoimmunity. Now what's interesting is that smoking increases the risk of developing Graves' disease or hyperthyroidism, but smoking is associated with decreased Hashimoto's incidence because it decreases TPO and thyroglobulin antibodies. Now, I'm not telling you to rush out, if you have Hashimoto's, rush out and start smoking, but it's just interesting to note that cigarette smoking can increase thyroid antibodies and cause Graves', but it could also decrease thyroid antibodies associated with Hashimoto's. Interesting fact. Number 5 is viruses. Viruses can stimulate autoimmunity. And if you've watched a number of these videos in the past, I've talked about the cell danger response. Dr. Robert Navio did a brilliant paper on the cell danger response, and what we know is that when viruses enter our cells, it stimulates this innate immune response and defense response within the cells called the cell danger response. And one of the steps is to decrease cellular energy. And so we're going to get decreased thyroid transport, we're going to get decreased glucose transport into the cells to help regulate metabolism. The body does this as a natural defense to try and kill off the virus, because the virus uses our own genetic replication for itself to replicate. So when somebody has a virus, another one of those steps in that cell danger response is to dump genetic material out of the cell, and that can stimulate or cause the autoimmune attack when we have chronic viral infections. Drugs, there's a number of drugs that have been associated with triggering autoimmune conditions. Drugs that change immune system function, like interferon alpha drugs, iodine-containing drugs, drugs that disrupt iodine transport into the thyroid gland. There's drugs that disrupt thyroid gland and thyroid hormone function, and there's so many of them that this video, I don't have enough time on this video to go through them all. But understand that drugs, while they may do one thing, they also have a number of side effects. And so you may be taking a medication for a condition that's actually causing a hypothyroid condition or an autoimmune condition. I'll talk about one of those specific drugs for heart palpitations or for fibrillation in a future video. Problems with the microbiota. So the microbiota is the organisms, and especially the organisms that live in your GI tract. You have about 100 trillion organisms that live in your GI tract, and they need to be in a specific balance. They need to pretty much stay mostly in the colon, and when you have an overgrowth of organisms, or you have a imbalance of the growth of organisms, if those organisms get out of the colon and up and overgrow in the small intestine, or they get out of the GI tract into the lymph tissue and into the systemic tissue, they can trigger autoimmunity. The thyroid gland is unique because its connection with the gut lymphoid tissue. There's almost a direct connection between the gut lymph tissue and the thyroid lymph tissue. So bacteria and organisms that are overgrowing in the gut and get into the gut lymphoid tissue can get directly into the thyroid gland and trigger an immune and autoimmune response. There can be vitamin D deficiencies, and not everybody's necessarily needs to rush out and start popping a bunch of vitamin D, but if you do find that you have a vitamin D deficiency, it can be a cause of thyroid autoimmunity because vitamin D helps regulate the immune system. If you're vitamin D deficient, you have to consider, do I get out in the sun and get sun exposure? Am I in an environment where I'm actually, where I can get sun exposure? Is it the time of year where I'm just not going to get any? If you're taking vitamin D pills or vitamins or supplements and you're still vitamin D deficient, you have to consider the fact that these are fat-soluble vitamins and you need healthy bile function, healthy gut function to absorb these. So if you're vitamin D deficient and you're taking vitamin D, you have to consider that maybe there's some bile or gallbladder issues going on and not allowing you to absorb those. There's other things that have to be considered, and that is, do you have vitamin D polymorphisms, which means that the receptors for which vitamin D aren't working functionally or not working appropriately. And you also want to take into consideration that vitamin D may not get converted into its active form. My good pal Dr. Ben Lynch did a great presentation on vitamin D 125, and how vitamin D functions and vitamin D polymorphism. He actually did a pathway planner to show how vitamin D is utilized in the body and the different pathways it can go down. If you haven't seen that planner or don't know of Dr. Lynch, go to seekinghealth.com. You can find lots of videos that he's done on different aspects of folate physiology, genetic and methylation challenges, and you can find that probably find that video on vitamin D. They talked about a number of chemicals that can cause and be linked to thyroid autoimmunity. PCBs, bisphenol A, phthalates, brominated, chlorinated, fluorinated products all can disrupt thyroid function and trigger thyroid autoimmunity. And lastly, in the paper, they talked about heavy metals and how they can create thyroid autoimmunity, and they touched specifically on cadmium and manganese, and both these guys in excess can trigger autoimmune conditions. So those are some of the environmental factors that are linked to causing thyroid autoimmunity. Remember, if you have hypothyroid symptoms, the vast majority of cases of hypothyroidism in the United States are caused by autoimmune attack on the thyroid gland. So if you get diagnosed with hypothyroidism and your doctor says, we just need to put you on Synthroid or levothyroxine or Armour or whatever, you want to find out if your thyroid condition is an autoimmune condition. If it is, you want to try and figure out what the root cause of your autoimmune condition is. It may be 2 or 3 of these things that are causing that autoimmune attack, but you owe it to yourself to find out, because what we see clinically and what's been shown in the research is that if you have one autoimmune disorder and you don't find or get to and address the root cause of what caused your first autoimmune disorder, the likelihood of having a second, third, or fourth autoimmune disorder in the next 3 to 5 years is really pretty high. So you don't want to just give thyroid hormone and disregard the fact that it's an autoimmune disorder. If you need thyroid hormone just to address what's going on, then maybe you need it. But you also have to get engaged and get involved and figure out, or work with a functional medicine doctor like myself, because this is typically not investigated in conventional medicine, and you've got to find out what those underlying factors or triggers are that are inducing the damage to the thyroid gland. All right, so that's the end for this edition of Thyroid Thursday. Look forward to more Thyroid Thursday videos in the coming weeks, and if you have any questions, put your questions below wherever you watch this video. If you'd like some help with your thyroid condition, always feel free to call my office, Chronic Condition Recovery Center, You can find me at chronic-condition-recovery-center.com. You can also find me at my thyroidproblemsdoctor.com website as well. All right, take care.